So, your loved one needs some help or has fallen ill, and you need someone to look after them, but you have no idea where to begin to find the right care. Let's Talk Home Care with Aishling is here to help. Join us weekly on our journey to educate families on home care for their loved ones. Now, here's your host, Aishling.
Welcome, everybody, and thanks for joining us today on Let's Talk Home Care. We're happy to be able to share our podcast designed specifically to educate you, the public, on everything that encompasses home care. As you know, I created this podcast because I wanted to tell the stories of home care, focusing and making an impact in and around our community. I'm going to bring you the simple truths and unedited footage from our speakers and special guests. We'll talk about the good, the bad, and the ugly of home care. This podcast is genuinely educational, and if you're looking for truthful information, then you are in the right place. So buckle up and let's begin. So today I have a very special friend with me, one that I work very closely with in the community, referred to all the time. And in addition to that, as professional comrades, we have become great friends because I really believe in what he's doing. And as everybody knows, hospice is very close to my heart. So today we're going to be speaking with Hakeem Bailu from Oasis Hospice. And Hakeem, welcome to the show. We're delighted to have you.
Thank you very much, Aishling. It's a pleasure. You're a very sweet person, and thank you for the opportunity to come on your show and talk a little bit about hospice.
Right. Well, we're delighted that you're here, Hakeem. So one of the purposes of this show is to educate those that actually don't know what it is you or I do, or how we would even work together. And many folks don't understand home care, let alone the word hospice.
Yes.
So why don't you tell us, first off, the name of your company, where your company is located, the areas you cover, and then we're going to dig down deep and we're going to talk about hospice.
Definitely. So, as you said, my name is Hakeem Bello. I'm the owner. I own Oasis with my wife, Shade Bello. And I also dabble into the business development aspect of Oasis. We're located on 10010 West 190th Place in Mokina, Illinois, 60448. And we are licensed in Cook, DuPage, and Will counties. Those are the three counties we cover.
Great.
So and we do take care of patients at their home or any nursing facilities, assisted living facilities, independent or supportive living facilities. Wherever the patient calls home, we go and take care of them. Yes.
Great. And I love that you said that, because that's one of the things that we say as well. We're in home care, but it might not necessarily be in the home. It's wherever the patient calls home.
Yes, definitely.
All right. So now we're going to blow the cap off of this word, hospice, right? Because
Yes.
that's a bad word in home care. And it's almost like a swear word in Ireland, or an X word that you don't use, right? Nobody wants to hear the word hospice, which tells me that when somebody doesn't want to hear what you have to say, it's because they have a preconceived notion of something that you're going to say that's not necessarily true, or they don't want to hear it.
Yes.
So tell me, or you tell the listeners here, what is hospice?
That is the $1 million question when it comes to the health industry, when it comes to end of life. That's what basically hospice is the dreaded H word, to where when you tell people hospice, they take off running the other way.
Uh-huh.
But really, hospice is end of life care. Basically, that's what it is. Just like you go to your regular doctor to get a checkup or just overall care, or you go to a specialist when it comes to, if you have a heart problem, you go to a cardiologist,
Sure.
or you have any kind of specialist you go to. Hospice care agencies, we specialize in end of life care. That means we provide comfort, we provide support. And it is not just the medical aspect of it, it's also the psychosocial, because it's a team effort in terms of making sure that patient is comfortable and symptom free.
Right.
Now, I'll read something I pulled up from the American Cancer Society. It says, like, what is hospice care?
Sure.
So it says, this is from Dame Cicely Saunders, is one of the founders of the first modern hospice in Britain.
Okay.
Because they hospice started in Britain as a volunteer and non-for-profit. They do it for free just to care for people that need the service. But in America now, you have a lot of agencies that do it for non-for-profit, but you have a lot that is for-profit.
Right.
So it is kind of skewed in a way. But this is what it says. It says, what is hospice care? It says that you matter because of who you are. You matter to the last moment of your life. And we will do all we can, not only to help you die peacefully, but also to live until you die. Now, death, when people hear death, they're like, oh my God, I don't want to die. Even someone that is 100 years old, we come across family members that still wants to hold on to dad, to grandpa, and they're over 100 years old. Right? We actually had a patient, 103.
Wow.
Is that love? Nobody wants to see their loved ones go, but unfortunately, that is the cycle of life.
Yes.
We give birth, we grow old. It's time to go. For us, it's all about the legacy we leave behind, in all we do. But hospice is a special kind of care. When that time comes to where everything you've done, when you've been diagnosed with a end of life condition, then they talk to you about hospice. There are different types. When I say different types, you have palliative care and you have hospice care. But overall, it's symptom management.
Right.
For hospice, we specialize in end of life. That means bringing comfort to wherever you call home, bringing the care. So we have a team that goes in that cares for you, top to bottom. But there are certain things you have to kind of decide before going into hospice.
Right.
Are you still pursuing aggressive treatment? Are you still you still want to? I'll give an example like cancer. So if somebody's been diagnosed with cancer, what stage is that cancer? Do you want to pursue aggressive treatment? Do you want to do chemo? Do you want to do radiation and all this? If you're still doing all that, then you have to look into the palliative care. But if you've decided that, you know what, I'm done with all the treatment, or I don't even want to do any treatment, then that's when hospice comes in, because that is an end of life care. We still come into you, we still come into the house, we take care of you, we do all that. So yeah.
Now, let's clarify a couple of things. I know what you're talking about, but again, the purpose of this podcast is to educate people. And I know people are going to be listening and they're like, what did he say? So one thing I did hear you say is that they would recommend hospice. So who's they? Who would recommend hospice for a family member? Who should be recommending hospice for a family member? Who are those people? Talk to me about those people.
That's a very good question. I think the first thing is, has that patient been diagnosed with an end of life? Is
so
it
a terminal disease.
A
terminal disease, something that they're not going to beat. Let's break it down for the listeners.
Yeah.
Okay.
So do you have a terminal disease? So if you go to a doctor today and they said, well, sorry, you have a terminal disease and your stage, whatever that stage may be, that is the first aspect of it.
Okay.
And that is when palliative or hospice can step in
Okay.
at that early stage.
Now,
Palliative steps in at that early stage because we're managing the symptom of whatever that terminal disease is.
okay.
So now the person have to decide, do I want to pursue an aggressive treatment when it comes to whatever that terminal diagnosis is?
Okay.
So once they decide if they want to pursue the treatment, then is more palliative. So they can make that decision themselves. So the patient, the family member,
Uh-huh.
or the doctor will suggest that this is what we're saying, and this is where we think you should go with this.
Sure.
So at the end of the day, the person themselves, it starts with them. It starts with the patient. What do you want?
Okay. So what I'm hearing here is that obviously it happens on the medical side, or should happen on the medical side, that your doctor and or your discharge planner, your nurses, people that are working with you who know your condition should really be the initial folks that can potentially guide you or give you choices as to the next steps, right?
Yes.
What I would like to say is that what I'd like today, by the end of the show, is that the listeners actually understand the difference themselves, because and I know that there are many folks out there, Hakeem, that don't have anybody to represent them. And last week, I actually had a nurse advocate on who explained what advocacy is and where they can help. And this is actually one of the ways a nurse advocate could help if indeed there was a family member who didn't have anybody to represent them. And furthermore, God forbid it was somebody in end stage of dementia, they're not even able to verbalize. They have no cognitive ability to even make any decisions, even if you were to present this to them. So this is important that people who are like you and me now in our 40s, 50s, or 60s understand and are educated about the choices that they have when they actually do go into hospital. So let's go back to the palliative. So for the sake of understanding, what I'm getting from what you're saying is that the team would recommend that if it's not terminal, we'll say, that they would possibly recommend that you have palliative care to sustain you for maybe a longer length of time before you would go into hospice, right? Am I understanding that right?
Well, the thing with palliative is once that determination has been made that this person has a terminal disease,
okay,
the next question is, do I want to pursue an aggressive treatment to treat whatever that terminal disease is?
Okay.
So I think it's a decision. So let's give an example, say for like cancer.
Okay.
Do you want to pursue an aggressive treatment?
Okay.
That is the first question you have to answer. And if the answer is yes, I want to pursue aggressive treatment, then it's palliative. You cannot go on hospice because by Medicare rules, you cannot be pursuing aggressive treatment and be on hospice. So palliative will help manage the symptoms. It may be agitation, it may be nausea, it may be pain. So it's controlling that pain, and the palliative team will work with the primary care physician of the patient to make sure that the symptoms are managed.
Sure.
So that is what palliative is. You can still pursue aggressive treatment. And usually the prognosis is 6 months or more. But when it comes to hospice, that means after you've done everything, after the treatment, after you've pursued the chemo, the radiation, and because it gets to a point in time to where all the medication doesn't really work.
Of course.
Once you've made that determination that, I've tried all this, I'm tired of chemo, radiation, and all this, and nothing is happening.
Right.
Then that opens up hospice.
A whole other conversation.
Yes, which is, end of life. That means I want to be left alone. I just want to be comfortable. But there's still symptoms. There's still things related to whatever that diagnosis is, that, it may be pain, it may be agitation. That is when hospice comes in, because we specialize in taking care of or
Right.
managing those symptoms related to the disease.
Right.
So now the first thing is, okay, I'm not going to pursue any aggressive treatment.
Okay.
The next thing is your doctor. They have to be two doctors that says, yes, this person has 6 months or less to live if left alone.
Yes.
If
And
left alone,
that's not a guarantee, right? I mean, these are mile markers, so to
no,
speak, right? Because I've had people in hospice
no,
for 3
because
years.
oh yes, yeah, we too. We've had people for over 2 years. So
Mhm.
because they say you have 6 months, not mean you have. We're not God. We don't
Right.
control
Of
that.
course. Of course.
So sometimes the care you get and the care that is provided
Mhm.
actually helps.
Yes.
Because a lot of people are on all these medications. Our medical director will look at every single case, look at the medication, look at, you
Sure.
know, so once everything has been looked at, then actually some medications may be taken off and we see the improvement
Mhm.
actually in the quality of life for that patient. So it's not a death sentence. And I think that's where a lot of people have that misconception or the fear that once you get on hospice, that means you're going to die the next day.
I know that is a huge misconception that is out there.
Yeah.
And I suppose, both of my parents died in hospice, and that's why it's such a subject that's so near and dear to my heart. Just because if I didn't know what I knew, I actually feel that there would have been more suffering for longer when we had to say, okay, stop it now. They're not
Yes.
going to rebound from this. And now let's help them be comfortable, enjoy the time with us as their family, figure out all the things they want to say, all they want to do, or put the things in place. And it actually was. And I've said this to you before. No, it wasn't nice to watch your parents, come
Yeah.
towards the end of. No, that is not nice. And anybody that tells you that it is, that's not truthful. But what is beautiful about it is that the elephant's out in the room and everybody's had these discussions and we're all on the same page and we're all working for the betterment and the quality. And I say that again, the quality of the life that is left, because it's a burden also that's off their minds as well, because they've given up to fight the fight and now they start to transition to acceptance, and it evokes all sorts of other different conversations. So thank you for sharing that. So I actually just learned that I didn't know, Hakeem, that your disease can even be really terminal to be in palliative. So I learned something myself today. Now, not to get into the weeds of what's covered and what's not, because I know that there's two big differences between palliative care and hospice care in regards to medications and who pays for them. So can you share a little bit, and don't get too deep into it, but we'll have you back on the show again, but just give us the basics of what is covered under palliative and what's covered under hospice, because at the end of the day, there's lots of things that aren't covered, and I think the listeners need to know about that as well.
Yes. Well, for palliative coverage, more or less, you're still your insurance, if you have a private insurance, they still cover the regular, medication, and all the deductibles are in place, so they cover all that, if there's Medicare or Medicaid that has been covering your medication, they will still do that.
Okay.
But when it comes to hospice, hospice is paid for by Medicare.
Okay.
100% if you qualify for Medicare.
Okay.
If you're not, old enough to qualify for Medicare, then Medicaid or your private insurance, most private insurance cover hospice care.
Okay.
Now, Medicare, like I said, covers hospice 100%. That means anything related to your hospice care. That means the medication. The DME, which is a durable medical equipment, any kind of equipment you need, wheelchair, oxygen, and all that is covered. Anything related to the hospice diagnosis is covered. So all the medication related to the hospice diagnosis. So let's say you came on hospice for stage 4 cancer or end-stage renal disease and things like that. So all the medication related to that hospice diagnosis is covered 100% by Medicare.
Okay.
Now, let's say we have somebody with stage 4 cancer and they're diabetic. Now, that you know, the
Say that
diabetic
again,
drugs.
Hakeem, because you broke up
I'm sorry. So I'm saying an example is when,
there.
let's say
Okay.
we admit somebody that has stage 4 cancer
Okay.
on hospice care,
Uh-huh.
and
Uh-huh.
that same person has diabetes or, you know, some other things that is not necessarily end stage.
Right.
Your private insurance covers those medications. Like, I'm giving an example of diabetes. So let's say the
Okay.
needle, the insulin, things like that is covered
Mhm.
privately with your insurance. But the hospice, anything related to the hospice, medication, equipment, the care, Medicare pays for it 100%, no
Okay.
cost to you.
Got it.
Yeah.
So how would a person apply for hospice?
Well, once you go to the doctor or to the hospital and they say you have a terminal disease, like I
Okay.
said before, the question is, do I want to pursue an aggressive treatment or not? If the answer is no, I don't want to pursue any aggressive treatment, then you tell your doctor, your primary care physician,
Mhm.
to write an order for hospice. Now, you have
Okay.
a choice as to which hospice agency you go to. Now, I know most hospitals, they have agencies they work with,
Mhm.
or some hospitals have their own hospice agency, but you have a right to choose which agency you want your loved ones to go.
Say that again, please. You
You
have a what?
you have a right. You
Mhm.
have a choice. Most of the
Mhm.
calls we get at Oasis Hospice is from people going on Google, just looking for hospice agencies around, you know, around their homes or just generally.
Right.
And most of the time, just if you're going on vacation, if you want to buy something, we read reviews.
Sure.
And those are
Sure.
genuine reviews, you know, people write. So we get a lot of calls because Oasis Hospice is a, you know, 5-star rated agencies in, you know, for agents in the last 7 years, and their reviews on, you know, on Google. So
Yeah.
do your research.
Uh-huh.
They may give you a list, but go read reviews, look up that company to say, okay, do I want my loved ones to, you know, be taking care of this company? There may be bad reviews, or maybe they're not showing up to take care of, you know,
Right.
their patients. So these are things. So you have a choice. So anyone can make the recommendation to hospice. It can be
Right.
the patient, the family member, the doctors, the medical team taking care of you. They can recommend, but we have to come in to do an assessment to see
Mhm.
if they qualify for hospice.
Mhm.
Yesterday we went to, you know, into a facility to do an assessment. The patient doesn't have any terminal illness or any prognosis or 6 months or less, so we didn't sign them up. So it's not just, you
Right.
know, signing people on, you know, onto hospice just for the fun of it.
Sure. Sure.
You know, so we have to assess them, and our medical director has to agree that based on the medical report we got, they have
Uh-huh.
6 months or less, you know, to live if left alone.
Now, I just want to go back to that
Mhm.
because you're a business owner and I'm a business owner. And I think one of the biggest things that people don't understand is the time that you and I put in that is not chargeable. That well, you probably could charge it, but I know I don't, and I know you don't.
Yeah.
So you just said there to me that you were called out yesterday. So you had a paid member of your staff that was called out that had to sit there and probably do a 3 or 4 hour assessment for you to come back and say this person is not hospice ready.
Yeah.
So right there, that really bugs me because you were given bad information. No, let's call a spade here because these are the things, Hakeem, that need to stop. So why were you called out to begin with if the person, you know, wasn't fit for your services? Because that's a total waste of your time. So was the
Well,
medical information wrong?
well, so this is what happened. So the son, maybe a couple of months ago, took mom to the hospital because
Uh-huh.
mom had um, a situation, and they took her to the hospital, and
Sure.
she's been in and out of the hospital quite a bit.
Mm-hmm.
And so the doctor said, you know, I think you need to consider
Yes.
hospice. She had a stroke, and because what hospice does sometimes, if you qualify, is we try to take care of you so that we reduce the hospitalization going back and forth.
Of course, very
what
draining.
exactly is going on.
Yeah.
So the doctor more or less told him that I think you should consider hospice. So I think he really took that seriously. And when the mom went back to the facility, there was a decline.
Okay.
And so they gave him, a list of hospice companies to consider, because he said, what, I think I need to, take a look at this and see.
Sure.
So they gave him a list of hospice companies to look at, but he took it a step further. And that was what I was talking about earlier. He did his own research. He went, the hospice companies, the hospice agencies they gave him, he went on Google to look them up and read reviews.
Right.
And I think what he said he did was, he said the best hospice agency near me and Oasis Hospice came up, and our reviews were much better than the ones they gave him. And that's why he called us that, hey, I want the service for my mom. And we went into the facility to assess her based on, the documentation we got. Then we realized she wasn't terminal, to be on hospice. So sometimes, it's the information. It may be a misinformation. We still do our own assessment to make sure they qualify before we bring them on.
Right. So in that sense, he was doing due diligence and he thought this might be a good fit, but it turned out that she doesn't qualify based on the parameters that you have to follow. So answer me this then, Hakeem. I know you can't reveal, medical information, but would she be palliative?
Yes, and that was the next thing I wanted to say. So they're going to send a palliative order. So we're going to go in and assess her to see if she, qualifies for that. Because for palliative as well, there have to be a symptom we're managing. It's not just sign them on, There have to be a symptom we're managing. So it can be pain, agitation, nausea. What is it that you're palliating? What is it that you're what symptom? So we're going to assess her for palliative services. And if she doesn't qualify, she doesn't qualify till that time comes.
Right. So just to further define with this particular situation, this is a good situation in the sense that the doctor is seeing that this lady is back and forth. And we know that that's happening more and more and more today, where there just aren't the resources out in the community, and the paramedics are called to the house, they take them to the hospital, and then it's a cycle that goes over and over again. So kudos.
It's an expensive,
absolutely.
Insurance companies are spending a lot of money, and just the inconsistencies in care.
And a lot of it is unnecessary as well.
Definitely.
Let's put that in there as well, because I'm not trying to be a negative Nelly here, but there's a lot of bad stuff that goes on out there, and not a lot of people will say that, but I will, because I'll tell you the truth all day long, every day, whether you want to hear it or not.
I know you do. That's why I love working with you, because you're straight up, you're honest
people need
about
to
the
know
situation.
this stuff, Hakeem. They need to know this stuff. So I want to go back to something that you said earlier. Again, you do have fabulous reviews, and I gave you one myself. But I want to also, Hakeem, let people know, because this goes on today as well. There are people who write their own reviews and fictitiously put names out there on Google. And I know you haven't done that. I know we have not done that, but I know it goes on. The point I'm trying to make is, if I was an innocent family member who just listened to this podcast, and I'm thinking, oh my gosh, I do know a little bit about palliative care. I do know a little bit about hospice. My mom is sick. She's declining. We'll say she has dementia. And maybe we need to look at this. What sort of research would that family need to do? Because to be honest, it shouldn't be all about Google, because we know that sometimes a lot of those reviews are not good, are not good, or they're not genuine. So if I was a family member, what other research would you tell me that I have to do? Would you think maybe calling the agency up and talking to somebody like yourself that can kind of walk them through it might be important? What recommendations would you give a family besides the Google piece?
Well, yeah. Well, I think
I told you I was going to ask you tough questions.
No. I really understand where you're coming from, because sometimes I've gone on Google to where you read reviews, and what you actually get is, totally different. So, and I agree. Sometimes talking to people, really, you feel the genuineness, and but be ready. Ask a lot of questions. What type of service, are they going to provide? How many times are they going to, come to the home? Who are the people coming to the home? So generally, I would say all hospice companies have the same kind of care.
Yes.
They have a nurse, they have a CNA, they have a chaplain, they have volunteers, they have a social worker. So most people have that. But at the end of the day, what is the quality? When you look at Medicare guidelines as to how many times you can get this, you can refuse any of those services I mentioned, but you cannot refuse a registered nurse. That is a service, if you go on hospice, you cannot refuse. Because some people have Aishling care in their home, taking care of their loved ones, maybe, living care or 24/7 care.
Right.
That they don't need the CNA from Oasis. So it all depends on the situation. Some people have that already. Some people have a pastor that comes in and all that. So they may say, well, we don't want your own chaplain. Like Oasis, we have music therapy. Not all hospice agencies provide that, but we provide that to anyone that wants it. It's free. We don't charge for that.
Right.
We provide, the RN nurse goes minimum twice a week.
Okay.
Now I'm finding out that some agencies, apparently, they go once a week. Now that is the minimum Medicare requirement, and so some agencies will do that to save money. I'm not here to bash anyone, but for Oasis, we go minimum twice a week, and if the patient needs more visit based on assessment, we provide more. The next thing is CNAs, certified nursing assistants. We provide 3 times a week minimum. There are some patients that we're actually doing 4 or 5 times a week because they really need it.
Right.
Some agencies don't do that.
Right.
We provide music therapy. We have a chaplain. We have a social worker that helps with the psychosocial needs. Do you want to write the will? Do you want to do a do not resuscitate? Any kind of psychosocial needs, we help.
Sure.
Do they need the Meals on Wheels? Are they VA, veterans, to where they want to tap into their benefits? So we do all these things. The social worker help in just planning.
Sure.
Then we have volunteers, but because of COVID, we kind of put a stop to that. So you have a team. Then we have a medical director as well that oversees this team and oversees your care as well. So every patient that comes in has a team assigned to them, and them only. So so it all depends on the situation at home, but those are the services we provide, and and that's why we're one of the best out there. Not because I'm I'm part of Oasis, but
Right. Well, no, I mean, I'm so glad that you said that, because I've just learned 3 things right there that I didn't know, and I'm in this business for more years than I'm even going to admit. But point in case is, I wasn't aware that you could say you didn't want to have your chaplain because you may have your own. I wasn't aware of some of the things that you can refuse, but that the nurse is super important. So I really appreciate you telling us that, because this is the things, Hakeem, that families need to know, and they just don't know. They just don't. So I'm really glad that you shared that. And it sounds like you gave the same advice that I would give. We all think we're the best at everything, right? My agency is not perfect. Sometimes we don't do as good a job as we want to. And sadly, it's not always my fault. It can be something a caregiver said, right? That's yes. But what we will do is try to correct it and we'll try to fix it. But transparency and communication is key. And I would say to families, just like you did, if you have a good feeling when you talk to us and we walk the walk with you, we educate you, then call 2 more people and see who made you feel the best and who's going to help you through this, who's going to be the right partner, because that is so
yeah,
important.
definitely. Just that phone call does a lot, because even sometimes sending messages, you don't really you don't really express everything. But when you talk to people,
right.
when you call the agency, are they rushing you off the phone? Are they
there it is. Say that again.
Are they rushing you off the phone because it's like, okay, this person is wasting my time, and they have a quarter to fill. So I think you have to be very, very careful. You have a choice, even when the social worker or the facility or the hospital gives you a list. You still have a choice and to do your due diligence. It's just like me giving you a list of vacation spots. Go check them out, look at it, and have that feel. So by calling, talk to them, ask all those questions, and if they're rushing you off the phone, then guess what?
They're not a good fit.
That tells you something. There's a lot of caregivers, and I really, really want to commend caregivers like you providing that support, for families, or a daughter or a family member that decides to care for their loved ones. It's a lot of work. And a lot of people don't know that hospice care can provide that support for them. So you're having additional resources, additional people coming, like the CNA. They come, they want to make sure your loved one is taken care of top to bottom. They bathe them, they just groom them just to make sure that they're fine. They change them.
Make them feel good.
And that can be that 1 hour rest that caregiver needs. And it's free, it's paid for by Medicare. And so I always stress that look into that. If your loved one qualifies for hospice, it's a free service. You don't get one bill. You don't pay for anything when it comes to hospice. But a lot of people don't know that. And it helps them in terms of the symptom management. You cannot be taking care of a loved one and they're in pain constantly. There's a solution to that. So
now I'm going to have Pete Miska. I'm sure you know Pete Miska from Phoenix Home here. He's like the guru of home health, and we're gonna have him on one day as well. But I want to go back to something that you said. I have 2 questions, and the first one is that you said that you can send out a CNA 3 or 4 times a week, at minimum 2. We know that many folks only send 1 because they're cutting back on the profit piece. So to be quite candid then, Hakeem, how do you make money? Because at the end of the day, we're all business owners. We want to help people, but the finance piece has to work as well. So as a business owner, if you're sending somebody 5 days a week because you feel that you just want to do this for the family and whatever, you're not really being reimbursed for that.
No, you're not, because Medicare pays
a certain amount,
a flat fee. So if you go 1 time, if you go 10 times, it's the same amount they're gonna pay you. But I think when we started Oasis Hospice and Palliative Care, really it wasn't about money. Actually, if I know what I know now,
you never would have done it.
I think I would have. If it's for the money, I think I would have gone a different route. Because this can be really emotional, because a lot of times the family members, actually all the time they become our families. And a lot of times the family the patient don't have any family member around them. If they're in a nursing home, their family may be out of state or sometimes even out of the country.
Right.
So we are the only one they have. So we get attached. So every time we talk about patients that, that passed away, my team, we have a box of tissue already because everybody is in tears because they connected with that patient and they become like
and it's so
their
personal.
dad, their dad or their mom or their uncle. So it's not about the money, to be honest with you, because when we started this, it was providing quality care, exceptional.
Right.
Now, I know earlier when I said we're one of the best, this is the thing we have. We have what we call the spirit of excellence in everything we do. I'm not saying we're perfect,
right.
But just like you, we own up. If a CNA, a nurse didn't do the right thing, we own up right away.
Yes.
And we fix it and we move on.
Yes.
So that is what we do. We have a lot of families recommending friends, other family members that need hospice because of the care we provide.
That's the best referral that you can get is word of mouth.
And I'm telling you, that's the money. That's how we when you say how do you make money, it's when people say, you know what, go with Oasis because they actually do care. That's my reward. I go to bed, snoring, I'm like, you know what, we provided the best care possible. So that is where the reward is. The money will come in its own way,
of course.
But we definitely want to provide, if a family needs 5 days for CNAs to come help them,
then that is
what we do. No questions asked.
Yeah.
Not all our patients need that, but some do, and we provide that. And it's a good feeling when you can help.
Yeah.
And when you now see the difference, when you can provide respite for that caregiver to say, 5 days rest. And that is another thing. Medicare actually pays for respite. So respite is if you're taking care of a loved one at home. So let's say you're a caregiver, a family member that is taking care of a loved one at home, and they want to go on vacation and they need, a few days to really recoup, revamp. Then you can actually take that family member into a skilled facility for 5 days, and Medicare will pay for that.
Right.
And we go in and we take care of them as if we're taking care of them at home.
Right.
In whatever facility, you decide to take them, and you can go on vacation or do whatever you want to do. They pay up to 5 days. And that's another benefit a lot of people don't know.
And that's actually a great topic for another show, Hakeem, because people don't even know what respite care is. And obviously Aishling Companion Home Care does respite care as well. But I think we need to do a whole show just on that, how it's paid for and whatever. And I'd love to do a whole show on the caregiver burnout piece because oh my gosh, that's such another aspect. Yeah, that's a whole other ball of wax, as we say, for sure. Are you familiar, Hakeem, with Maya Angelou? Have you ever heard of her?
Yes, I have.
So everything that you have said leads me to what we use actually oftentimes in our own marketing materials, and that is that people they'll never forget what you said. People will forget what you've said. They'll forget what you did, but they'll never forget how you made them feel. And it sounds like you guys have that approach. And I know that's what we like to do here as well, is that we like to be able to do our best every single day so that all of us can sleep at night, like you said, and sleep peacefully and say, well, you know what? We did everything within our power to make that situation good. And today was a good day, right?
Definitely. And you have to, because I to be honest, I don't know any other way to do it, because that brings me joy. I do photography as a passion on the side, and when I see the smile, when I take a picture and I show my client the picture and I see that smile, most of the time they'll tell me, oh, I look horrible in pictures. And once I take that picture and I just watch them and I see them smile, that is more than even getting paid, seriously, because the joy that brings, that transformation. And that's what we do when it comes to our team. They come into your home and they bring that joy. One of
Yeah.
our taglines, we use for Oasis is we bring you refuge. When you look at refuge,
Sure.
we bring that to wherever you call home. We show compassion, we show love, we hear you. A lot of times people talk, but we don't hear them.
Right.
So we bring all that as much as we can, and we do the best we can to take care of you. Is it always perfect? Because sometimes the family dynamics is really not the best. But we understand, and we try to work with family members as much as we can, and just it's all about the patient, because sometimes it shifts because of the family dynamics. It goes into,
I was just going to say that's a whole other podcast, family dynamics.
So it goes into about the family dynamics, and we don't want to get into family drama. We're here to take care of the patient, even though we still take care of the family as well. But it is all about the patient, and
I learned
that's
that
what we bring.
very early on. About 3 years into my business, I'm like, I will have one point of contact and one only.
Because it can be messy, very, very messy.
Been there, done that, got the sticker. No,
Yeah.
we're not with 10 different people playing telephone. He said, she said, I think I might. No. One point of contact, so the communication is clear. I feel your pain there. I know what you're saying.
No, you don't want to get into, you don't want to get in the middle. That's why the social worker is crucial as well, because going into people's home, you see and feel, it's a privilege. So you cannot, you have to be careful, but we have to be professional as well, to where we identify, not causing more stress. Usually the patients are okay. I would say majority of the patients are fine. They've accepted the condition, and they're like, just let me be
then
comfortable.
It becomes peaceful.
But most of the time is the family dynamics that causes stress. So that's why when we come in, we bring in a chaplain. If it's a spiritual thing that that can bring that calmness, then we see that, and we recommend to say, hey, I think maybe you want to talk to the chaplain, just to vent, or whatever you need to do. Or the social worker, if it's a financial situation going on at home, if it's feeding, things like that, the social workers can get involved. Meals and Wills, just things to help. There's a lot of resources out there. People don't have to suffer alone. People don't have to take care of their loved ones alone and not know what to do.
And that's as you know, that's really one of the reasons this podcast was created, because I came from a small town in Ireland, very large family, and again, I can just tell you that at the end of the life situation for both of our parents, you could sense the release from all of us. You could sense the love. It was so abundant and voluminous in the room, because we had worked through everything we needed to work through, so that every day was so special. So special. And that, to me, again, is what's so important. And Hakeem, I can't thank you. I mean, this information is just amazing for people that listen to this show. I mean, I'm just so honored and privileged to have you on, and to thank you. I adore you. You know that. I tell you that all the time.
Thank you.
Fantastic work. So we have to wrap up here now. So Hakeem, one final thought for people that listen. If you could tell families one little nugget of advice if they're going down this journey looking for hospice care, what would that advice be?
I think once you or your loved ones, get that news that nobody wants to hear, that you have a terminal disease, whatever that that is, I think is making a decision. Okay, do I want to fight this? You have a right. Of course, everybody wants to leave. Nobody wants to say, yes, I just want to give up.
Let's be done.
Do all that. Get that out of your system. But if after everything has been done and nothing seems to work, and they've given you that news, then you have to look into hospice right away. For
Right.
me, I think once you have that diagnosis, I think you should start looking into hospice and palliative care, because palliative care can walk with you through the journey of you
Sure.
doing your aggressive treatment. But once that doesn't work, then it's an easy access to hospice, and that doesn't mean it's the end of life. It's
Right.
just planning. Just like we buy a car insurance, nobody wants to get into an accident,
Of
but when
course.
you get hit from behind, you're hoping that person has an insurance that will cover your medical expenses, and so
Uh-huh.
so so I think then you need to do your due diligence, that wherever you go, hospital, nursing home, your own private home, do the research, call,
Hmm.
talk to somebody,
Hmm.
ask questions, because
Yes.
usually this is new to a lot of people. You know, um, everything is fine. One day you just go to the hospital, like, oh, sorry, dad has stage 4 cancer. You're like, what? Where did that come from?
Oh, uh-huh.
And that news does,
Uh, uh,
so call. We're here. We'll listen. We don't rush you
yes.
off the phone.
Uh-huh.
Oasis cares. We care about giving information to people, even if you don't go with Oasis.
Right.
Seriously, even if you don't pick us, but we will still explain every single thing you need
Educate
to know.
yourself.
We'll educate you and give you
Right.
all the resources that is needed to
Uh-huh.
make an informed decision.
Right.
That is the advice I'll give, that do your due diligence,
Uh-huh.
ask questions, make phone calls, go online, just read up, just understanding what hospice
Sure.
is and what is
Sure.
not.
That is great advice. And just real quick, Hakeem, how did you come up with the name Oasis? I'm sure there's a meaning behind it. Is there?
Yes, it's actually my wife. It's something in the Bible, is a place of rest, a place of refuge, and that's what we want to convey, to people, and actually do and practice,
Yeah.
a place of. So we add that, we bring that. So
Mhm.
wherever you call home, we bring that peace, joy, comfort, you know, just
That's
care.
beautiful.
We carry that around us. So every single team member embodies that and carries that with them.
That's
You know.
amazing.
So
That
so
is amazing. Thank you for
yes.
sharing that. I was always curious. So, Hakeem, once again, time flies when you're
I
having
know.
fun.
I know.
It's been such a great conversation. And again, I want to thank you so much, because this information is just invaluable to folks who are listening to this podcast. And I personally found it extremely insightful. I hope to have you back in the not too distant future. We'll talk about some other stuff that we didn't get a chance to today. And I want to thank you on behalf of the seniors for all the great stuff that you do out there in the community. It is appreciated. We appreciate you. And thank you so much for coming on the show. We'll see
Thank
you
you.
again. And as we say in Ireland, Slán, which is goodbye, and Gurb Míle Mágad. Thank you
Thank you
so
so
much,
much,
Hakeem.
Aishling. Hope to talk to you soon. And
You
people,
too.
Aishling is the best.
Oh,
Go. Her
this is
agency
about
is
you.
awesome.
This is about you. It's not
No, no,
about
no,
me.
no,
This is
no.
about
I mean, I
thank you.
respect you, and thank you for everything you're doing in the community. So
I thank you, Hakeem, for being part of my community.
no
Appreciate
problem.
you. All
Anytime.
right.
Take
Stay
care now.
safe out there. Bye bye.
Okay.